Good morning and welcome back. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And a special welcome to those of you who are joining us via live streaming. Welcome. I am so pleased to have with me this morning Dr. Craig Samitt, who is Chief Clinical Officer and Executive VP at Anthem, Inc. And he is very, very committed to improving healthcare from the inside out. Transformation is the name of the game at Anthem. And I'm so pleased, Dr. Samitt, that you'll be able to speak with us about that.
Good morning. Thanks for having me.
You are speaking at this conference about connectivity, interconnectedness in transformation, and how that really plays a key role in that strategy. How does that work at Anthem?
Well, I've always been part of interconnected systems, specifically the relationship between payers and providers. And so one of the key areas of focus for Anthem is provider collaboration. How do we as payers and providers align specifically around the focus of delivering better care at a lower cost for our members and the providers' patients? The focus of this conference is very much about interconnectedness of information. And generally, I feel that information is the most valuable, but to date, the most underutilized resource to help drive the transformation of healthcare.
Okay, so a lot of information gathering and the data is going to be very important going forward on how you deliver your services. But how do you protect the information once you have it? Cybersecurity is a major issue.
Well, cybersecurity is a top priority for Anthem and for any organization. We want to safeguard the information that we collect. The reality, though, is without having the information, or more importantly, when information is in silos. So if health plans have a certain set of information, hospitals have another set, and patients themselves have their own most crucial information. If we can't align and connect the information, albeit keep it safe, if we can't align the information, we can't think of the patient as a whole, we can't think of a population as a whole.
What is being made possible at Anthem that was not there just even a few years ago?
The focus of our collaboration has really motivated us to find ways to align information. So for example, health plans probably have the most complete information set, but it's delayed information. Hospitals have the most acute information set, but it isn't complete. So if I'm a hospital, I may know what's happening to my patients here, but I may not know what's happening to the care that's provided to my patients elsewhere. And then finally, patient information is probably the most relevant, but the least actionable in and of itself. And so our focus at Anthem is how do we assure that our claims information with the clinical information and data from providers and with consumer self-reported information, how do we bridge them together, again, with the focus around the single individual, the care for a complete patient. That's what we've been doing at Anthem very significantly so that we can have a full view.
Okay. Are you getting the cooperation that you need to make this effective? It sounds like these are great goals that Anthem has, but you also have a community, different roles in the community that have to agree that this is a priority for them.
I think the collaboration could actually be better. We use the expression that where there's a will, there's a way. And when it relates to information, I think we have a way. I don't think we have a will. I think that we live in a world where we believe that information is power, so that we hold on to information to ourselves as opposed to share information. I think the only way we're actually going to transform healthcare is if we view information as a common good, which is that the information I have should be shared with the information that physicians have, which should be shared and aligned with the information that the patient has. And only when the information is together are we really going to transform. I think historically we've been reluctant or afraid. We haven't had the will to share that information with others. We haven't had the trust. I think once we have the trust, a lot of the technical aspects of fixing healthcare become a lot easier.
You're participating in a panel on this very topic. What
Yes.
are some of the other takeaways that we haven't covered that you want to leave with attendees?
I think that we focus a lot on sort of alignment and integration of the healthcare delivery system. I would argue that alignment and integration of information is probably even more important. We talk about delivery system reform, but the reality is that there are many organizations that aren't structurally integrated that have been able to share information and to focus on care for patients that span the continuum without having to be in a vertically integrated structure. So I can't underscore enough the importance of alignment of information, even more importantly than vertical or structural integration of our system.
Okay, Dr. Samitt, thank you so much for your time today.
Thank you very much for having me.
And I'm just speaking with Dr. Samitt of Anthem, Inc. Please stay tuned. We have many more interviews to come. You're watching Healthcare, World Healthcare Congress 2017.